Hi, I'm Dr. Jamison Spencer. Today I'm going to fit a silent sleep appliance. Back here I have set out my silent sleep bite gauges, and this is going from end to end in this position and then going progressively forward. If the patient's jaw is a Class 2 Division 1 jaw relationship, then you can also turn the bite gauge over, and then that would allow for a more retruded position of the jaw instead of a protrusive position of the jaw. So with the 4 silent sleep bite gauges, you actually have 7 spots that you can put the jaw. Or most of you are going to be familiar with use of the George gauge. This is a George gauge with the fork broken off, and this can be used in just the normal method in order to find the bite position using the George gauge, and then you can use that while the silent sleep is being fit rather than the silent sleep style gauges. So that works great too. I like to hold the appliance in my hands like such in order to access the holes. And then we have our GC reline material, which comes with your kit. I'm going to go ahead and start injecting this, focusing on the retention holes through the center . The material has a long working time, so it's not necessary to go really fast with this. Come around to the top. Fill this in, and then I make sure there's a little bit of material around the back. The retention holes through the center of the appliance, and then in taking it a little bit around the back ensures that the material is bonding through the appliance, so it's just not in the retention holes on the side, but once the material is set, you'll have a homogeneous set material that goes through and around the back of the appliance, making it virtually impossible for this to come out without you desiring it to come out. Okay, so that's set. Now previously I had checked the position, and Jenny preferred the end-to-end position, so we'll go to the mouth now. Material is a little goopy, but you get good at using this after a while. And open for me wide. I put this down on the lower teeth. Her tongue is to the roof of her mouth. And then place the bite gauge in between the teeth, close down. She will find it, and that is end-to-end right there. Go ahead and push your tongue as far forward as you can, the roof of your mouth, and against the bite gauge, correct. Hold that, and that's where you're going to hold that as it sets. You can close your lips around the bite gauge too. The material has about a 5-minute set time, and so we're just going to go ahead and film this until it's completely set. I will usually hold the bite gauge or have an assistant hold the bite gauge while it does set. If the bite gauge was to go down, that would push the jaw farther back. If it was to go up, it would pull it a little bit forward. So while it's setting, we want that to be nice and stable, just like you were holding an impression tray and didn't want it to move. The material has virtually no taste. It does not smell bad. It's pretty benign. It also will not run all over the place. You do need to be careful with any kind of significant undercuts, like under a bridge or other potential problems like that. You can check the tray in advance of putting it in the mouth to make sure that it's not going to irritate mandibular tori or exostoses. So we will let this set for a few minutes. If the silent sleep bite gauge vertical dimension is too great, you can increase the grooves on the bite gauge by using a slow-speed handpiece and a burr to make the grooves deeper, and that will reduce the vertical dimension of occlusion. For most people, this is about right. This is about 7 millimeters of opening. Another way you can do that, and I'll kind of illustrate this, I'll put this back in, open just a titch, is the patient can stick their tongue out between their lips and close down on their tongue. That is less precise as far as holding that, and also the George gauge can be used, and the George gauge comes in different increments of vertical opening. I'm going to go ahead and slide that back in there. Open just a titch. Good. And we're still back on. You have your tongue pressed down still. Let's see how we're doing. Up a little bit. Okay. We are almost set. We'll go ahead and give that a full set time. After the appliance is set, then I will trim up any excess, make sure that there's been good adaptation to the tray itself, and make sure that there's no problems with that. Trim it up, and I'll show you how I trim the appliance. Okay, just right here, open. Okay, that's about it. Go ahead and open a little bit for me. So take out the bite gauge, put that back, and then open. Okay. Okay, good retention on the lower. So that's the appliance after it's set. Okay, we see good adaptation to the teeth. The material has extruded through the retention holes as desired. It is all the way around posteriorly, also as desired, on both sides. Okay, now I'm just going to take that into the laboratory and trim it with scissors and get rid of some of this excess material back here posteriorly. I've noticed that in the retromolar area you can grind that out a little bit with a slow speed, and that'll make it more comfortable for the patient. This really doesn't require much in the way of trimming. None of this material is thin. None of it is going to pull away from the tray itself. So we could just be done right here, but there are a few things that we can trim up that will make it a little bit more comfortable.